Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. I'm curious, Christian. You see the signs, you talk to medical professionals, you seek a mental health professional. I'm curious, and I'd imagine a lot of other people are going to be too. How do mental health professionals diagnose mental health conditions in children? How's that happen?
Well, there's several. There's one model, but there's several different avenues, right? So healthcare professionals take into consideration several factors. It's a biopsychosocial, the biological factor of how they're made up physically, psychologically, cognitively in their mind, how they're made up, and socially, what's going on in their world, in their home, in their community, their social setting. So so at home, you're looking at all those things at school, and then in their personal life and their friends in addition to what the parents are saying, so you're taking in all that information. The child is also assessed by using an assessment to rate a score or severity of symptoms. So this can be done through some of the batteries that they have, some of the testing that they have. It can be a questionnaire. It could be an assessment. It could be 50 questions, but they all differ based on the conditions and the symptoms that are being reported. Once all this information is collected, right? So you get all this information, then what we'll do, we'll use a diagnostic statistical manual, which is called the DSM-4, which is moving to DSM-5 pretty soon. What you want to do is see if their symptoms match the diagnostic criteria. So the criteria is based on the severity of symptoms. So that's including the length and the duration, the frequency, how much it impacts their daily functioning. So it's basically a holistic approach that you want to look at, that you're looking at on how they're functioning, and then you basically come up with a diagnosis and the conditions that best match the criteria in the DSM.
I love these conversations, Christian. There's a science behind it, and people don't need to be afraid. I know when you're dealing with your children or a loved one, you're protective, right? You don't want to necessarily turn them over to a system that you don't understand. So that's why I think these conversations are really important. I appreciate you helping to break that down for our viewers and listeners. We've got a whole separate video here at Brother Be Well on how we go about talking with the kids that we're talking about, how we talk to them about mental health. So check out that video. We've got a whole conversation on it. But for the sake of this conversation, Christian, can you briefly summarize how we include children in talks about their own mental health?
Well, I'd say, Michael, the first step I would recommend is really establishing that foundation and environment where it's okay to talk about feelings. And as you hear, again, you hear a theme, right? Where you're starting while they're young, you're starting while they're young. There's different things you can do while they're young, from that age of 0 up to their teen and the young adult years. So incorporate things to spark the conversation. Incorporate things that they like and they enjoy. One example I like to give parents is the Disney movie Inside Out. It's a really good movie that really talks about, it's animation that talks about emotions and feelings, what's happening on the inside and how it comes out. Watching that movie and having a conversation about it afterwards, that right there is a mental health talk, and you're involving them in a mental health conversation. We involve them by teaching them how to express their feelings, with exercises and books that are easy to read. One exercise to have a feelings chart in the home. So I encourage a lot of families to who experience children who have mood disorders and challenges regulating their emotions, to have a feelings chart in the living room. Now, have it somewhere out in the open where families spend time. And this chart shows facial expressions, and they can point to how they're feeling when they don't have the words to say it. So they may be an outburst on the couch. You teach them, explain to me, tell me, how are you feeling right now? Show me on the chart. They can point to it, no words required, right? Continue to ask them process questions, such as how did that make you feel? So now you're forcing them to process their emotions and their feelings. Um, so wording is very important as well. And ask questions in the right manner. That's very important. It's not what you ask, but it's really how you ask it, such as, I observed that you stay in your room most of the day and you don't ride your bike as much, versus saying, what's going on with you? You don't ride your bike anymore. See, it's a difference. So it's an observation, and it's really detaching that experience with them versus blaming. What's wrong with you is a blaming. And shame comes with that versus, I observe. You're a bystander. You're on the outside looking in. They can disassociate that feeling from the experience.
And they can also, I would think, feel free to disagree if you've got that climate of conversation, and you can say, I observe that, and they could feel free to say, well, you're drawing the wrong conclusion. I appreciate that, but that's not what's going on. And then through that process, you'll get a little more information about what might be going on.
Oh, I'm glad you said that, Michael, because you're absolutely right. Now you're having a positive feedback loop. So now you can it creates accuracy in the assessment that you're making with them. So I'm glad you said that.
That's what happens, Christian. You and I've been friends for about a year and a half. See, I'm learning from you. So I picked that up from a prior brotherly well conversation. Appreciate that. Appreciate that. If you would take a second before we have to get out of here, can you touch on two of the primary ways in which mental health in children is treated, psychotherapy and medication? Can you touch on those two?
Yeah, in addition to therapy and medication, as you mentioned, there are several modalities in terms of treating mental health conditions with children, and they're treated through therapeutic behavior services. It's called TBS. It's usually like a Medi-Cal service. So if you receive mental health services through Medi-Cal, there's something called TBS services, and it's a more intensive service. So most therapy is like once a week, right? You go once a week, see your counselor for 50 minutes to an hour. You come back next week. Sometimes it's every 2 weeks. But TBS is more intensive services for children who are experiencing some severe mental health conditions that needs to be seen more than once a week. So they may be seen 3 times a week. And this requires a multidisciplinary team. So you have rehab specialists, you have therapists, doctors, psychiatrists who create a treatment plan intended to treat the existing issue for at least a few times a week. So it's more intense. This could include, here's some other ways: play therapy, which, by the way, has been proven to be the most effective form of treatment for children, music therapy, parent child interactive therapy. We call it PCIT. This is a treatment modality for parents who don't who aren't familiar with being a parent, right? So this happens a lot of time when a parent is incarcerated and now they're being reunited with their child, and they don't know how to be a parent. So what we do, we put them in a room, and the parent has a microphone in their ear, and there may be a window, a glass window, where the child can't see us, and we're talking the parent through what to say to the child, how to interact with them, how to build rapport, and the child doesn't know we're talking to the parent through their ear. There's also this was um, it got a bad rap back in the day, but it's gotten much better. But still not very common. Electroconvulsive therapy, which is a procedure conducted by a doctor, actually, where small currents are passed through the brain to treat extreme cases of depression, mania, and extreme vegetative states. So it kind of allows the brain to those neurons to start firing again in the brain. And it's done by a doctor under anesthesia.
You mentioned you just given me a great idea for another conversation because the minute you said we used to call it, I think colloquially, electroshock therapy. And you're right. I remember some of that negative connotation. And if you're saying it got a bad rap, maybe we'll have a separate conversation on this platform about it if you'd be open to that.
Oh, most definitely.
I feel like I'm always recruiting you for other conversations, Christian. So don't let me wear out my welcome here,
Well,
but
it's
I
all good.
appreciate that.
No, no, that won't happen.
Let's do it, man. Let's do it, man. And before we run out of time today, I would imagine there's a parent, there's a caregiver listening in on this conversation or taking a look at this video, and they've seen some of the behaviors you've outlined. They're scratching their head. They're going, I've seen some of that. Maybe there's an issue. And they're wondering about how they're going to be able to help their child cope with mental illness. What are your recommendations for that parent or caregiver?
Michael, I would say, starting off, to reach out to your primary care doctor and request a mental health assessment. That's the first step. If you've already, as a parent and caregiver, have noticed some of these signs and symptoms, and you already have an idea something may be going on, This will provide a good starting point, as to what's going on with your child, and if further professional support is needed. So at the very least, at least they can receive that ACEs assessment. They can receive a PHQ, which is a health questionnaire, with your primary doctor. It's questions that very simple questions that's done to find out how you've been. Are you stressed out? How much you've been dealing with in terms of anxiety or depression. There's several different tests they can do that are very simple. Also, I would say to the parents to be an anchor and someone they can rely on, being emotionally available and calm throughout the process. So many of children's mental health conditions are due to how parents regulate their self, and how the child is modeling how to handle stressful situations. They're watching you. And a lot of mental health conditions, such as borderline personality disorder, anxiety, some of these conditions are learned. They're not biological. They're not hereditary. Some of them are learned by their environment. So you can prevent a lot of those pre-existing conditions in terms of mental health just by modifying and modeling how you're portraying behaviors to your child. And for parents, don't be afraid to sign up, for those classes. I said before, you sign up for workshops and on how to be a better parent and parenting classes. It doesn't mean you're a bad parent. You're just learning more tools and skills to learn to be a better parent. So those are some recommendations I would provide for any parent or caregiver.
Christian, I cannot thank you enough. The phrase worth your weight in gold comes to me when I think about you. None of the work we're doing here at Brother Be Well would be possible without the help of clinicians like you. Thank you, sir. Christian Jacobs, marriage and family therapist, and Brother Be Well clinical advisor. Thank you, sir.
Thanks, Michael. I'll see you next time.
We'll see you next time. Take it easy. And I want to thank our sponsor for this particular conversation, and in fact, the entire Parents and Caregiver series. That sponsor is Blue Shield of California, and specifically their Blue Sky initiative. That initiative boosts access to mental health support. You can learn all about it at bluesky.blueshieldca.com. That's bluesky.blueshieldca.com. Another website I'll tell you about, keep it in mind too, brotherbewell.com. This video and videos just like it, audio podcasts, compelling print pieces, all kinds of resources designed to help you on your mental health journey. It's all available at brotherbewell.com. We're a membership supported service. So if you can join us as a member, we get excited when we get new members. But maybe you just want to sign up for our blog. You can do that really quickly and for free. Give us your email address, and 2 or 3 times a week, you'll get notifications when videos just like this one go live on the platform. Again, all of that's available at brotherbewell.com. My name is Michael P. Coleman. I'm content director for Brother Be Well, asking you to do 2 quick things for me, if you would. Take great care of yourself, and then reach out. Once you get that down, reach out, grab somebody, take care of somebody else too. Till next time, bye-bye.